Security Challenges in Healthcare IoT. I'm Tonya Hall, and joining me is Dr. Elisa Costante, Vice President of Research at Forescout Technologies. Welcome, Dr. Costante.
Thank you for having me, Tanya.
Of course. So, what does Forescout Technologies do?
Forescout Technologies is a cybersecurity company, and we provide visibility and control to our customers. With visibility and control, we mean that we are able to understand all the devices end to end that are within the network organization, and we can actually allow to put in place mitigation and control activities like isolating the device or segmenting it.
So, tell us about Project Memoria and the TCP/IP vulnerabilities that Forescout found in healthcare devices.
Of course, Project Memoria is a project that we started beginning of 2020, and what the main goal is to actually do the largest study on TCP/IP stack that the industry has ever done. So we analyzed TCP/IP stack because those are quite core components that can be found in any network device and can actually are at the core of allowing network communication and IP Ethernet based communication. So Project Memoria started, as I said, in 2020, and by now we are out with 4 studies around it. We have started open source and closed source TCP/IP stack, and what we have found has been like a sort of trend and patterns in the way that devices are vulnerable. Some of the vulnerabilities actually they are very similar to what was found in IT system at the beginning of the 90s, and that's why we actually call the project Memoria, because it sends back these memories. And the important part of it is that it actually connect to the supply chain kind of vulnerabilities. So whenever you find a vulnerabilities in a TCP/IP stack, what you do, you actually have, the disclosure happens with the vendor of the stack. Now, this stack can actually be found in many downstream devices. So what it means is like the end device, like cameras, doorbells, switches, and servers, are actually can include this TCP/IP stack, but the vendor with which like the researcher have to interact to disclose these vulnerabilities has not as limited visibility in which other devices the stack is actually used. And this includes a lot of challenges for the disclosure, for the patching and the security of these vulnerabilities. The main problem is identifying affected devices and actually communicate effectively to the vendors to enable them to release patch. To give you an idea of this, when we did the first study of Project Memoria, which is Amnesia 33, we actually have identified around 180 different vendors that will be affected. And as per now, like we are in June, there are still advisory coming on of vendors that are confirming or denying. So it takes really a long time for patches to be issued, which means device can actually stay there unpatched for a long time.
What makes health delivery organizations more susceptible to these risks?
Well, this is actually quite interesting finding that we had by doing a research on our device cloud. So Forescout actually maintains a device cloud, which is a collection of device-related information, and we have that we collect anonymously from our customers. So this cloud contains, for instance, the list of devices that are out there, what the operating system is running, what is the vendor, what open ports, what are the strange communication, etc. And as per now, we have more than 13 million records. So it's actually the largest collection of device information that you can find out there. And what we have done a research to understand, okay, what are the vectors, verticals of business that are actually more impacted. And surprisingly or not, healthcare was amongst the highest one impacted. So it was the one with the highest number of devices that had at least one vulnerability affecting the TCP/IP stack. So to give you a comparison, like healthcare was 5 times more vulnerable, or let's say more exposed to these vulnerabilities than other verticals like government or retail.
So, what does this say then about the difficulties of managing cybersecurity in the IoT world?
Well, that's a super interesting question. Like when you have patch. There is a difference between when you have to patch an IT device and when you have to patch an IoT device. So let's say that you have Windows vulnerability, right? Like on Tuesday, patching Tuesday, the vulnerabilities from Windows will be out, and most of the IT system administrators, security guys, they actually know how to push for those patches on the laptop of all the employees, because on our laptop there is an agent, so some software that is able to be instructed to update the software. Now, in IoT, this is not as easy. First of all, because you have a variety of operating system, a variety of vendors, and so you do not have, like just a few operating system that you can put an agent on. And most of the times, actually, this IoT, one of the distinctions between IT and IoT is that they are agentless or unmanaged. So there is not such an agent running on those IoT devices that can say, okay, camera, now you update yourself. No, that's not how it happens. And you cannot do it at scale. So if you are vulnerable to many vulnerabilities from different vendors, you actually most of the times have to download the patch manually from the website and log into the devices and do the update, or rely on the third party maintainer of those devices to do the update for you. So it's quite more expensive and complex procedure.
What are best practices that health delivery organizations should consider to mitigate risks?
Well, they definitely need to start with the visibility. So they need to understand what devices do they have. Also, like especially in HDOs, merging and acquisitions are very common. So like a lot of networks are joining the main networks coming from extension, let's say, of the HCOs. So understanding what vendors out there, understanding what is the security posture and the risk level, for instance, of every device, will allow to create the best cybersecurity strategy. So if you have the risk and you know that IoT, for instance, is your biggest risk at the moment, then you can actually put your budget around securing that and around deciding whether patching is possible, or putting segmentation, or putting monitoring, because you want to be advised if an IoT device is used to as a stepping stone into your network to actually send data outside of your network, and you might be at risk of a data breach. So all of this is a multi-step kind of strategy that needs to be taken in place, and each step will guide the next one.
Where can people go to find Forescout's report on this issue?
Yeah, they can go to our website, so forescout.com, and under the research lab page, there are all the reports that we have produced in the last years that go span from security for healthcare, for building automation, for critical infrastructure and OT, and the latest project Memoria findings.
Dr. Elisa Costante, Vice President of Research at Forescout Technologies. Thanks for joining us, Elisa. If somebody wants to connect with you, what's the best way they can do that?
Well, they can definitely contact me on LinkedIn, or otherwise going on our website to get more information.
Thanks again for joining us.
Thank you.
And find and subscribe to more of my interviews right here on ZDNet, YouTube, iTunes, Spotify, Stitcher, or at tonyahall.net. Thanks for watching.